Carpal tunnel syndrome, symptoms, tests, and treatments. Carpal tunnel syndrome is a devastating injury that affects more than 8 million people in the United States and continues to increase each and every year. It is one of the many repetitive strain injuries that are everywhere: homes, offices, assembly lines, grocery stores, book clubs, construction sites, dental offices, everywhere. Because it is so commonplace and its effects so devastating, it is important to be knowledgeable of how it occurs, what its symptoms are, the testing methods used, and what treatment options are available, as the prevention of any injury, especially carpal tunnel, begins with education. Carpal tunnel syndrome is a disorder affecting the median nerve, which supplies function to the thumb, index, middle, and one half of the ring finger. Usually the symptoms are most prevalent in the thumb, index, and middle fingers and include numbness, tingling, paresthesia, which is pins and needles, pain and tightness in the front of the hand, wrist, and forearm. These symptoms do not have to occur simultaneously and may only affect one finger one day and then 3 fingers a few days later. If a doctor provides a carpal tunnel diagnosis and the symptoms are in the ring and little finger, it is not carpal tunnel syndrome. The ulnar nerve, not the median nerve, supplies function to the ring and little finger. Repetitive strain disorders affecting these 2 fingers are usually either Guyon's syndrome, entrapment of the ulnar nerve in the Guyon's canal at the wrist junction, or cubital tunnel syndrome, entrapment of the ulnar nerve at the elbow junction. This is a common mistake made by many physicians and is completely inexcusable, as they often recommend surgery for the patient, causing the patient to undergo an unnecessary procedure, and what makes it worse, for the wrong disorder. If carpal tunnel syndrome symptoms do arise, doctors will recommend that a nerve conduction velocity test or an electromyogram (EMG) be performed to see if carpal tunnel syndrome truly exists. These tests are often painful for the individual being tested, very expensive, and often give false positives and false negatives. This is why it is recommended that manual carpal tunnel tests be performed in order to obtain a more accurate and much cheaper diagnosis. Manual carpal tunnel tests take no longer than 10 minutes, have a high accuracy rate, are painless, and are very cheap in comparison to the NCV and EMG tests. The recommended manual carpal tunnel test consists of the following: the Phalens Test. In this test, the wrist is flexed for 30 to 60 seconds in order to compress the median nerve and duplicate or increase the symptoms. The Reverse Phalens Test. In this test, the wrist is extended for 30 to 60 seconds in order to stretch the median nerve and duplicate or increase the symptoms. Stretching the median nerve, if it is already impinged, will duplicate or increase the symptoms if a patient has carpal tunnel syndrome. The Tinnel Sign. In the Tinnel Sign test, tapping directly over the median nerve at the wrist junction will cause carpal tunnel symptoms to exhibit themselves. The Compression Test. Direct pressure is applied over the location of the median nerve for 30 to 60 seconds to see if carpal tunnel symptoms are exhibited. If a positive diagnosis comes back, most doctors will push for surgery, a procedure that has a terrible success rate and is to only be performed as a last resort once all the other conservative treatment methods have been utilized. Conservative therapy is the key to successfully recovering from carpal tunnel syndrome and obtaining not only short-term but also long-term relief. The following is a list of conservative treatments that should be utilized in order to help prevent carpal tunnel syndrome from developing, but also rehabilitating carpal tunnel syndrome after it is already present. Ergonomics. Utilize proper ergonomic tools and equipment when working. Breaks. Take short breaks every 30 minutes when working in order to help reduce excessive strain on the hands. Stretches. Stretch the muscles that close the hands, as these are the muscles that are exercised all day long in activities such as typing, writing, gripping a steering wheel, using a computer mouse, carrying groceries, and everything else that is done day in and day out. When a muscle is involved in exercise, it becomes shorter. Therefore, it needs to be stretched and lengthened both during and after the exercises are completed. Exercises. Exercise and strengthen the muscles that are used to open the hands, as these muscles do not receive much direct stimuli or exercise. For example, people do not turn doorknobs, hold things, type, use a computer mouse, or lift things with the backs of their hands. The information provided in this video reveals how carpal tunnel syndrome occurs, what its symptoms are, the testing methods most commonly used, and the best conservative treatment options that are used to thwart its existence. So, it's very important for individuals to become well acquainted with the proper information and tools in order to maintain and increase their level of health and productivity. It is also important for people to speak to their doctors regarding their health concerns, and if someone is involved in an occupation that is considered high risk for carpal tunnel, they should discuss this with their physician. But it is even more critical that people become self-educated, as no one can take care of you better than you. For more and detailed information on how to treat carpal tunnel syndrome effectively, check out Carpal Tunnel Master and Beyond on the link below this video.